It is, as you know, that Fiji is in a disaster-prone region, and over the recent years, we've had several cyclones, including the massive cyclone Winston. We've had national responses, and the deployment of public health and clinical rapid response teams to these cyclones. And in 2016, saw that we had multiple national teams deployed to hardest hit provinces, and responses by several neighboring countries, which are Australia and New Zealand, to name a few, under Fiji government's coordination. During the cyclone Pam in Vanuatu, Fiji became the first Pacific island to deploy an EMT to another country, emergency medical team, and Dr. Luke actually headed the team. And Fiji's also had a long history of deploying UN peacekeepers, and I'm pleased to say that over the last 4 or 5 years, we've also had our doctors and nurses, anaesthetists, surgeons, radiographers have been part of our teams that have gone to the Middle East, which is namely Golan. And so these are opportunities for our team to actually continue to practice, continue to be able to improve their awareness around this area. A key element to protecting the health of the population in a disaster or a biological event is ensuring that the health system has got sufficient capacity to respond within the first 48 hours. And as Dr. Luke had said, today marks an important day for our ministry because we are a recipient, and we are receiving a timely assistance for our Fiji emergency medical team from the government of Australia. And we thank the World Health Organization, because the World Health Organization actually brought this to the fore after Haiti and began to define what the EMT is, and actually taken it on a global scale. EMTs are important, and also they have an important role in global health workforce, and they are specific. They can be any health professional, doctor, nurse, or paramedic team. They can deploy within country or deploy outside of their country of origin, and they must have adequate training and quality assured processes, equipment, supplies, so that you can respond and meet the minimum standards of EMT and possess the quality of care that is appropriate for the context. And these items that we are receiving today assist Fiji's Minister of Health and Medical Services in achieving these goals. And part of our commitment towards disaster preparedness and experience of deploying national rapid response teams, the government, through the Minister of Health and Medical Services, accepted a WHO proposal to initiate the EMT process in October 2016. This was done so that we can expand our health capacity to respond and coordinate EMT responses much better. As you have heard, we had formed a technical working group to manage the EMT project, in particular development of a national EMT called FEMAT. The Australian version is called OSMAT, and I was quite pleased to say that I was up in Australia at the end of last year doing the OSMAT surgeons course, which I found very useful. So FEMAT will organize medical assistance and resources for deployment at the direction of the Fijian government in response to requests for health assistance in major situations, either nationally or medically. And as we also have been hearing this morning, we are working towards attaining our global verification for type 1 fixed emergency medical team. And an essential component of this verification is having our self-sufficiency in our type 1 hospital, as well as having the necessary resources, which includes the much needed equipment that we are receiving today. I'm told that the cache that is here includes rigid weatherproof tanks that will house the field hospital, generator, electrical equipment, water supply systems, and many more. And field hospitals must be large enough to accommodate short-term treatment and movement of at least 100 outpatients per day. And part of the cache includes also storage space for safe and secure storage of equipment, consumable, and supplies prior to deployment and during deployment. FEMAT teams responding to disaster must travel as self-sufficient unit and they'll be able to provide a reliable supply of water to each member of the team, apart from the needs of the patients. And I'm proud to say that we have secured a desalination plant and a normal water treatment system that can provide safe and wholesome water to a field hospital. Other items we are receiving includes generators for power consumption, lighting, equipment, powering the field hospital, communication equipment such as RTs, and a laptop and portable incinerator. There also some assorted non-medical equipment for the health teams to use whilst on deployments. And I sincerely look forward to seeing this when we go down to the FEMAT warehouse. The teams are just the initial support for the Fiji government. The items are initial support so that we can be able to continue to develop our FEMAT team. And with these items, FEMAT will undertake logistics training using these items. And I'm also very proud and pleased to say that we have identified individuals headed by Dr. Luke, Mr. Vimal, Mr. Ponichese, and our hard-working nurses, such as those that are here today and those who are not here. Also, I'm pleased to say that the Dr. Chosese, who's at the back, the head of surgery from CWM, has been a very strong advocate for supporting and also developing our FEMAT team. Deputy High Commissioner, Your Excellency, I'm indeed privileged and grateful for the Australian government. Australia and Fiji are great friends, and I'm sure our health team will utilize these items well in times of disaster response. And we acknowledge the continued capacity that building that Australia gives Fiji, and especially the Minister of Health. While I was sitting here and just thinking about Winston, I remember that day, and the weekend I was on call, and as a consultant, usually when you get called to the hospital, you always go. And that night the winds were so strong that I called the hospital and I said I couldn't come. And I went the next morning and saw how they responded. And then the next week we started deploying, went to Bonombalau, and I looked at how the place was, and I realized that we are facing the storms of life, and we have to know how to respond. Being in Bonombalau, being part of the first reconnaissance mission was an eye-opener. I realized that the disasters will come. We cannot move our island nation away from the path of disaster. That's where we are. The coordinates are fixed, and it is in our best interest that we prepare. And we had teams that went to Koro and Bonombalau. Again, we are very grateful to the Australian government for supporting us in Koro, and to the New Zealand government for supporting us in Bonombalau. And there were lasting memories of working with colleagues. But more importantly for us, and Luki will attest to this, it changed forever the views that we had, that we had to be prepared. And that's why there's been a lot of passion around forming our FEMAT team, and also ensuring that we are resilient. And I want to end by saying that I stand here on behalf of many people within the Ministry of Health that lay their lives on the line in times of disaster. And I hope that with the FEMAT and the equipment that we have, that we will be stronger. Thank you.
Is basically we can have a fully fledged hospital with these items. The white flag is